Okay, welcome back to The Connection, the podcast where we introduce you to the people, services, and stories that keep healthcare close to home. Heart disease remains one of the leading health concerns facing Americans, but advances in cardiology are allowing patients to receive life-changing treatments with less pain, shorter recovery time, and better outcomes than ever before. Today, we're joined by Dr. Reddy, an interventional cardiologist with specialized training in structural heart procedures, including minimally invasive treatments for heart valve disease. Dr. Reddy is board certified in multiple cardiovascular specialties and has completed advanced fellowships across the country, bringing cutting-edge cardiac care to patients throughout our region. Beyond his impressive credentials, Dr. Reddy is known for his patient-centered approach, taking the time to ensure people truly understand their heart health and treatment options. We'll talk about heart disease prevention, common warning signs, advances in heart care, and how patients in rural communities can access specialized cardiac services close to home. Dr. Reddy, welcome to The Connection.
Yeah, thanks for having me.
So, can you tell us about yourself and what led you to become a cardiologist?
Sure, that's I'll keep it short, but I think, cardiology is from a perspective of a physician, a fascinating field because like you just mentioned, there's so many advancements that have been done where we can directly impact someone's life. To me, that's what drew me to cardiology, that I could have a direct effect, an immediate effect that people can feel. Not a lot of medical fields. I mean, there's, obviously different specialties that they're all good at what they do, but I just felt like cardiology, I can make a immediate impact where people appreciate what you do for them. So that's what kind of drew me there.
Was there any other specialty that you were interested in before you landed on cardiology?
Yeah, surgical specialties also fascinated me initially, where again, the same thing, right? There could be something wrong with somebody and you operate on them and they feel better. I mean, that to me, that's a pretty satisfying outcome. So I thought about surgery. The reason I ended up with cardiology is because I'm a little bit of a nerd and I love physics and there's a lot of physics involved with cardiology, believe it or not, in diagnosis and treatment. And moving away from surgery, I realized that I could have the same impact but doing minimally invasive procedures, like you mentioned, where we don't have to do a surgical cut down, an actual incision, but we can, through endovascularly, through vessels, deliver the treatment that is still giving the same outcomes, whether that's valve surgery or, valve procedures like TAVRs, aortic valve replacements, or, stents, where people have coronary disease, which is blockages in the arteries, or having a heart attack, like MIs, where we go and place stents through vessels and have a huge impact. So I discovered sort of both my love for, having that patient satisfaction, and at the same time, sort of the physics involved and the physiology involved behind fascinated me.
Very cool. So your bio mentions that moving to the United States at a young age helped shape your ability to connect with people from diverse backgrounds. How has that experience influenced your communication style or the
Sure.
relationships that you build with your patients?
Yeah, I mean, I moved at a young age from India, but my parents moved here, which is why I'm here. But we still have a lot of connections back in India. For me, it just sort of gives me a perspective of what people have in America versus what people don't have in other
Mm,
countries, right? So I can, I still go back and I have family. My cousins still live out there, and it's just a different world. The access to medical care, it's not as robust as it is here. So I it's sort of gratifying to see just the differences, and that I think it makes me a better person and a better physician because I'm able to sort of see what people lack. And then when you have it, right? So when you have it here, you can see that I'm better able to like kind of communicate that to people and say, look, what we're able to do is quite satisfactory, just because of just the lack of care elsewhere, right? So
yeah.
when you have that, you become more appreciative of what you have, and there's something gratifying about that. So I think that's what I bring. You know, again, and it gives me an understanding that everybody has different backgrounds, right? Like everybody
Yeah.
starts somewhere. Everybody has different experiences than you. And I think it just brings me that humility to say, okay, this is my life and my experiences, but I want to hear about yours. And I like connecting with patients and I want to hear their story. And I think that matters. It's not just what they're suffering from, but to understand them as a human, I think it's very important. I think it opens up a trust that's way different than just approaching, oh, what's going on with you versus tell me about yourself, like I want to get
Yeah.
to know you. Yeah.
For sure. So, heart disease is a broad term. What are the most common heart conditions you see in your practice, and what are some
Sure.
symptoms people should never ignore?
Yeah, sure. That's a great question. So common things are obviously, which is coronary disease, blockages in the arteries. That's the leading cause of death around the world and or in the United States is that people who have heart attacks, right? So, and then a lot of AFib, atrial fibrillation, which is the irregular rhythm in the heart, is notorious for causing strokes. So what I would say to people is symptoms you should look out for. I always urge my patients to move, right? Like you have to be active. I kind of have to take my own advice. Like I have to move too. And I make it a point to kind of take a walk or, walk your dog or go for a run if you can. Or, if you're able to work out and you have access to a gym, do that, right? Because that's when you're stressing your heart, right? It's essentially a stress test in a way, right? So you can, if you have chest pain or shortness of breath or tightness or palpitations that happen when you're, exerting yourself, to me, that's concerning.
Gotcha.
So that's how I kind of approach it. I say, well, how much do you move? How active are you? That's my first question because I want to know the baseline activity that patients do. And my next question is, are you able to do all of that without symptoms? Right? And the symptoms are what I mentioned, like chest pain, chest tightness, breathing issues, palpitations. Some people even have abdominal pain and nausea. Women specifically, it's been a long standing. We understand that women are undertreated because as physicians, you're not in tune to symptoms that are away from the chest area, right? Like, and for a lot of reasons, biologically we're different, and women have um, atypical symptoms. And to me, it's all about exertion. If the symptoms are happening when you exert yourself, and then you stop and it goes away, I need to know about that, right? Don't ignore those.
So, going back to women, then, if women are feeling nauseous or maybe getting a
Sure,
stomach ache when exerting,
sure.
that could be a sign of heart troubles.
Yeah, yeah, yeah. Believe it or not, people who actually come in with an MI, like a heart attack, a lot of the times, women specifically or diabetics who have, lack of nerve endings that are, have micro vascular disease sometimes, or also, just have neuropathy that they can't feel the typical symptoms that you're taught of like, oh, chest pain, the radiation to the arm that everyone hears about. A lot of the times they just come in feeling terrible. Like they just feel not like themselves. They can't eat. They feel nauseous. Of course, there's also GI stuff that can do that, right? Like pancreatitis, gastritis. I understand that there's similarities there, but that's our job, right? That's why you should seek care when it happens for us to say, okay, this is not the heart, it's something else. I rather rule out something that can kill you first, and then we can explore the other things, right? So that's why I really stress my patients to say, tell them to move, like exercise as much as you can, because that's when are you feeling the symptoms, right? Whatever that may be. Even if it's abdominal pain and it goes away when you don't exert yourself, tell
Okay.
me about it, right?
Yeah.
Seek care.
So, yeah, that's one kind of mission of this program is to help patients advocate for themselves. So
Yeah.
that's a great thing is if you're exerting and you're not feeling unwell every time, that might be a
Yep.
sign to talk to your
Yep.
provider.
Yep, yep. And to be honest, right? Like it could still it could be other things like I said, or your maybe your cardiovascular fitness is not where it needs to be. But I rather you meet me and we discuss this and you know do a test if it's appropriate, and then we can get you back into physical activity, right? What I tend to see a lot of the times, people are sedentary, and then let's say there's a snowstorm, they go out, that's the
Hmm.
classic example, is that
Yeah.
they go outside and start shoveling snow, and that's pretty exertional. Like it's quite demanding on your heart and in your body to shovel snow.
Yeah.
So you go from doing nothing to doing one of the most strenuous things. That could be pretty bad, and people have sudden heart attacks and sudden cardiac death from that. So if you're going to start an activity that's new to you, you've not done, you should talk to somebody that can maybe put you on a treadmill and do a
Uh-huh.
stress test. So we have access and we have equipment to help you if something does happen, right? And then if we do the stress test and it's okay, then we know you're fit for activity,
So,
right?
and I know that, our society is kind of like shifting to a lot more sedentary jobs, computer work and whatnot.
Yeah.
Are you seeing an increase in heart conditions, do you think, related to that possibly?
Yeah, I mean that's a great point. I mean, I certainly think that's going to play a huge role, right? Diet is huge, right?
Mm.
Access to good food is so tough in
Yeah.
in the fast-paced life that we live. We're always constant. I mean, including myself. Don't get me wrong. I'm not trying to preach something I'm not trying to practice, but including myself. You reach for the thing that's the quickest so you can just get rid of the hunger, right?
Hmm.
And then turns out the things that are easily accessible are not really good for you, right?
Yeah.
The processed foods, the packaged foods, right? That we just heat up and eat. And trust me, I've done that, and I still do that, and I have to be mindful of that for myself. So I talk about that with my patients. I say, if there's multiple ingredients, maybe we shouldn't be eating that, like ultra processed foods, right? Inflammation is a key thing that a lot of people are talking
Uh-huh.
about. And inflammation comes from ingesting things that your body is not used to, like smoking tobacco, eating really processed foods. Your body is reacting to it, and it increases inflammation, and that can lead to more heart disease. And sedentary lifestyle, like you said, people with AI now and remote work, and people just sit at their desk and never move, right? You have to make it a point. I tell people, set a timer. There's apps available for that now, or even just use your phone, set a timer and say, "Hey, I just want to move around every hour," right?
Hmm.
Just believe it or not, there was a new article in New York Times that I was reading it for my own education, and it's very interesting. They talk about, how like when people are trying to start a new exercise regimen, the hindrance is they feel like they're not completing the full exercise.
Uh-huh.
And I'll tell you that it happens to myself. I'm like, oh, I want to run 3 miles, or I want to lift this much amount of weight for this much amount of time. And then in my head, I'm like, well, I don't have 30 minutes, or I don't have 40 minutes. And I'm like, forget it. I'm not going to do it. Right. But it's interesting. They say don't look at it that way. Like, have a paradigm shift on how you think about exercise. Even if you move for 5 minutes and do whatever it is for 5 minutes, get your heart rate up, lift weights for 5 minutes, right? Or just literally burst of running to like maybe the garage or maybe the mailbox.
Hmm.
Believe it or not, that has an impact, right? So that will start getting you to move, and then it'll lead to more consistent exercise. I think that's the first hurdle. People feel like, I don't have 40 minutes for this. And they're like,
Yeah.
I won't even do 2 minutes of it, right? That's a bad approach, right? If you don't have 40 minutes, don't do 40 minutes, do 10 minutes,
Hmm.
right? And believe it or not, even short bursts of exercise has major impacts
Oh,
on longevity.
I think that's great advice. And look, everybody just got advice from a cardiologist. Get up, do jumping jacks, run in place for 5 minutes. Start,
That's a good
start a
jumping
new
jacks is a
habit.
good one. Yep.
Yeah. So speaking of supplements, there's a lot of stories about younger hearts being affected by these super caffeine drinks. Have you noticed that, or do you have anything to say about that?
Yeah, actually, that kind of comes hits a little close to home. I have a young cousin who's 17, and he had what's called supraventricular tachycardia. It's called
Hmm.
SVT. and all he feels is his heart racing. And it came from the first time he had, I forget what exactly he had. I don't think it was coffee, but some drink that was, it's marketed out there, right? Like they don't read if there's caffeine in it, or whatever, how many grams of caffeine in it, and he just drank it, right? And then he just went right into SVT. And not everybody who drinks that will get it, but if you have a nidus to get it, and then you ingest excessive amounts of caffeine or stimulants or whatever it is, you can kind of have these, you know, episodes. It doesn't necessarily mean you have a quote unquote bad heart. It's just you can go into these rhythms that can be unstable sometimes. People pass out from having fast heart rates.
Mm-hmm.
Yeah, I agree with you. There's a lot of supplements out there that are not being tested, or you can just buy them from gas stations, grocery stores, and it's quite, you have to look at it from a perspective of these companies are really kind of targeting, people who are young, who don't, when you're young, you think you're invincible, right? I mean,
Mm-hmm.
and maybe you are, right? Maybe you are a little bit, and that's why they tolerate it. But it unmasks something that's there, a nidus, when
Okay.
when you kind of reach for these supplements or stimulants. I would urge young people to kind of, just be mindful of what it is that's being put into your body, right? And I think the younger generation, that's what I think about for them, is that, don't get influenced so easily by these marketing campaigns or influencers that make it seem cool that you're living a great life. And I would urge them to kind of either seek care with somebody, physician that they trust, a primary care that they trust, or just do your research. Maybe back in the day we didn't have all these stimulants and all these things. I don't think we need those to live, right? Like, I mean,
Yeah.
people lived a long life without having all this stuff, and that's why you see an increased heart disease, diabetes, because we have all these fast foods and supplements, and people are just ingesting themselves, and we're not eating real food. And don't get me wrong, I understand it's hard, right? It's hard to get real food, believe it or not. Like, I struggle with that myself. I'm like, is that even like, does that even grow? You know what I mean? Like, I
Yeah.
ask myself that question. I'm like, what is that we're eating?
Mm-hmm.
And I tell my kids that. I'm like, but they just think it's coming from a grocery store, right? Like, they don't
Yeah.
understand, like, what they've never really seen a real rice paddy field, or like a, cornfield. I'm trying to educate them and do
Yeah.
that on my own, but it's hard.
Well, bring them, when you come out to see
Yeah,
us at Kit Carson County Memorial, bring them out here. We'll share them
absolutely,
where corn and
absolutely.
wheat come from.
That's right. That's right.
Yes. So you specialize in structural heart procedures. For those who may not be familiar with the term, what is structural heart disease and how does it differ from
Sure.
other heart conditions?
Sure, sure. So I like to I like to break everything down into simple terms for everybody. It's easy for everyone to comprehend that. I kind of joke. I say I'm the plumber of the heart, and I
Mhm.
kind of am, right? Because I place stents in the heart, which is more interventional cardiology, which means that you're having a heart attack, you have a blockage in the artery, and we go and place a stent to open up the artery. And then the electrical part of things are like the electrophysiologists who deal with irregular heart rhythms. I mentioned SVT, I mentioned AFib, things like
Mhm.
that. And then structural cardiology is a new field. It's been around for 20 something years. It's just kind of now coming into the mainstream where a lot of people are aware of it, because the access is a little bit more, widely available, not just in specialized centers. But basically, structural heart has anything to do with valvular disease. So, mostly aortic valves, which are pretty commonly calcified, and they become stenotic as a lot of people age. Some people more so than others, because there's more calcium deposition in some people due to genetics, due to their diet, due to their environment. So
Mhm.
you end up having a very tight valve. And the heart's a pump, it's trying to push blood out. And if something is tight, a valve, it can't really do it. So that's the way to fix it back 25, 30 years ago, was to open heart surgery. That was the only way to do it. But now we have the ability to do that via catheters, where a stented valve is mounted on a balloon, and we're able to expand it inside the heart in the valve, and it adheres and then starts opening by itself. And then you resolve the stenosis, and it's a 1 day procedure, and people go home the next day. It's done all through the groin most of the time. And that's one part of structural cardiology. In fact, Burlington, I've seen patients that have this disease, and I bring them to Denver. We do it at Swedish Medical Center, and they drive back the next day. I mean, of course, someone else has to drive them, but it's a 1 day in the hospital procedure, which, if you're 80 or 90, open heart surgery is not an option, right? Because you're not going to recover from cutting your chest open. It's just not possible, or it's going to be hard, right? You end up spending 6-8 days in the hospital, and you have to heal from this big incision. So that's who this procedure is meant for, is 80-90-year-olds that cannot undergo surgery, but they can undergo this procedure and have the same outcome, where if you don't fix an aortic valve, unfortunately people end up passing away in a year or two if it's severe enough. So that's one part of structural cardiology. Other parts are, people have congenital disease where they have a hole in the septum that's a divider in the heart. That can be fixed with structural work, which is essentially, again, through veins and catheters, we do that. And then there's a clip procedure we do for mitral valve disease, which is a valve on the other side, back of the heart, on the left side, that we're able to fix. Again, these are innovations and interventions that have been invented from the last 25 to 30 years, because for people who cannot undergo surgery.
And so are those procedures that you would call minimally invasive?
Correct. They are. By definition, they're invasive, but they're minimally invasive because we're not making a surgical incision, right? We're able to deliver these devices through veins and arteries. So by definition, that's how I think of it, as minimally invasive, because it involves closing that site that we make a small hole in with, we use sutures to close that, and then they lay flat for a couple hours, and then the bleeding risk is low after that, so they can move around. And then we keep them in the hospital, watch them overnight, and then they go home the next day.
Yeah, that's wonderful. I think especially for our patients that maybe don't love to spend the night in Denver, but that they don't have to spend a long time in recovery.
Sure, right? They can come back to their life in Burlington the next day.
Yeah. And then from what I've heard from patients who've had stents, it's almost immediate recovery from a lot of their symptoms. Is that accurate, or that they feel better very quickly?
Yeah, that's the hope. And that's why I love doing what I like to do, right? Because it's immediate impact you can have on people. They're immediately back to the valve thing, when the pump is working hard to push against the valve, and we fix that with the valve procedure, people come back and, they see me about 30 days after, and they're like, look, I'm able to do all the things I wasn't able to do. And it's human nature, right? When you can't do something and you're short of breath, every time you go do something, you stop doing it, right?
Yeah.
And then that's how people become sedentary, because they're like, well, I don't go walk to the mailbox because I don't like it. They don't like it because they're short of breath, and they may not know that once we fix it, now they can do it, right? And it is sometimes quite immediate, that feeling of like, I feel better. The stents is the same thing. When someone's having a heart attack, of course, and you go open up the artery immediately, they feel immediate relief. The pain goes away. Sometimes when they have a blockage that's chronic and they've kind of gotten used to it, they may not notice tremendous difference, but they can tell that now the heart's like easier in terms of, getting the heart rate up and doing more things. So I agree with that statement. People do feel better quite often, quite quick, and they can get back to what they want to do.
Yeah, and that's another great thing about our partnership with yourself and Dr. Rugas. If a patient does need to go to Denver for a procedure and then needs a little bit of recovery time, they can come back here to Burlington in our swing bed program and get some one-on-one care and still be close to home, which I think is
Yeah.
a really great thing.
Yeah. No, absolutely. I agree. I mean, our goal is to get people, home the next day.
Awesome. It's incredible.
Yeah.
And
No,
so
it is.
you did mention atrial fibrillation or AFib, and I know that that affects millions of Americans. What should our listeners know about AFib, and when should they seek
Yeah.
medical attention?
Yeah. So AFib, believe it or not, a lot of young people sometimes end up having it too. I see a lot of, 40, 50-year olds, coming in with AFib. And, what they should know is that the causes of AFib, okay? Age is unfortunately a factor too, but we can't, none of us can control father time, right? None of us can stop the clock. So forget about age for a second because you can't have an impact on that. But what you can do is control the other things that cause AFib, which is, having sleep apnea. That's a big one. People don't realize that sleep apnea is linked to so many other heart stuff, right? High blood pressure, blockages in the arteries, AFib. You fix the sleep apnea, people reduce the risk of getting all that stuff, right? So to make sure that if your partner or somebody is snoring, tell them that it's just like, hey, maybe you should look into this. I know people hate using CPAP machines, but there's other methods now to fix sleep apnea. So don't be turned off by, oh, I don't like this machine. I don't want to use it. But there's other ways we can help you. So sleep apnea, reducing the amount of alcohol you drink goes a long way in reducing AFib. Smoking reduces AFib. The reason AFib is important is it's not something that immediately has an impact on you, but if you leave somebody in AFib, especially the 40, 50-year-olds that are young in their life, when they're 60, 70, it becomes a big problem.
Mm-hmm.
Okay. It can lead to heart failure. It can lead to the heart remodeling. And I think a lot of people miss that piece because they're like, well, I feel fine now. And then another thing about AFib is it can cause strokes. And nobody wants a stroke, obviously. And, reducing risk of stroke from AFib is sometimes as easy as taking a pill, right? You take a blood thinner. Of course, that comes with its own side effects and things, but I'd rather not have a stroke. I'd rather know if I have AFib, right? So if you feel like you're having heart racing episodes or you feel like something is off where that feels kind of like thumping or like I can feel it in my ear, like this
Or like
ringing and
sometimes people call it like a flutter in their chest.
flutter. Yeah, that's a great, yeah, yeah, absolutely. All those things. Don't ignore those. And just because you're young and you're 40 or 50 or even like 60, I consider that young when it comes to heart disease. Don't ignore those symptoms, right? Immediately seek care. And now people have access to Apple Watch. And believe it or not, like a lot of patients that come to me, they're like, "Hey, my watch said I'm
Oh,
having an irregular rhythm." And I'm like, great, let's look into it, right? Let's put a monitor on you. It's not hard to do, right? But if you ignore it, things may be okay for a little bit. And then you start seeing the sequelae of it later on down the line. And it's just not good. It's hard to go back in time.
so so you're in the school of thought that if you're worried about it, just check it out now so it doesn't get worse later.
I think so,
Mm-hmm.
right? The tough part there is sometimes patients come and they're like, something's going on, and we're not able to really kind of find what it is that's going on, right? But to me, I'd rather have that conversation than you're like, oh, it's fine, right?
Yeah.
I'm still able to work. It's nothing. I just need to drink some water or maybe lose some weight or something. I mean, okay, but if it's AFib and I don't know, you just let it be. Sure, maybe it's okay for a little bit, but believe it or not, the heart doesn't like it, right? It remodels, and then you start seeing the sequelae from it, which is heart failure, leg swelling, you can't breathe, you can't do the things you want to do, the heart is racing, and then you're kind of playing catch up. Like it's hard to, you're behind
Yeah.
eight ball?
Yeah, and then you're going to need something more invasive to fix it.
Right, right.
So, in your bio, it also talks about you having a passion for serving underserved communities and have participated in humanitarian trips providing structural heart care in developing countries. What have those
Yeah.
experiences taught you about medicine and patient care?
Oh my gosh, I would say it has taught me more about life.
Mm,
Just just be grateful for what we have in life, to be honest. A roof over the head and just food to eat, honestly. My gosh, like it's taught me to be humble, and to be grateful. I would say be a good human being before you're good at what you do. That's what I believe in,
mm,
and that's what it taught me. It taught me to be a better human being before I became a better physician on these trips that I went. So, we went to Nicaragua. It was sort of a mission trip slash organized with University of North Carolina where I was, and we went down there, and it's fascinating on how much lack of healthcare there is. And they would walk on foot through like mountain regions to get to us to
mm.
seek care. Like they would literally hike days to come see us for that week we were there. So we
Wow.
were there for I think 8 days or something like that, and we saw a ton of patients with just it's unfortunate what they you don't have what you don't have, and you don't know what you don't know, right? So they come to you, and they are either really far gone in their disease process where we cannot help them, but a lot of the gratifying things were when we did find them early in the stage and we were able to help them in specifically to structural heart, a lot of congenital disease,
Mm,
kids that were born with malformations that we can help with. So things we could help with is what's called atrial septal defects, basically a hole in the heart that we were able to plug that. And these kids that come in, they're 18, 19 now, and they've lived with it all their life. It's fascinating to see how happy they are, right? They're just happy to be alive and just to play with their friends, and it's fascinating that we were able to do that. And then we were followed by a surgical team that came from Spain, actually, and they were able to do surgical repair on patients that we couldn't help with structural work through the catheters. And it's just amazing. Like you're just grateful at the end of it, just to be where we are in America and have the care we have.
yeah.
So yeah.
Now that's incredible. So, living in a rural area, many people delay seeing specialists because they're busy or just, in our culture out here, it's just kind of like just work, work, work.
Yeah.
So, people sometimes maybe assume that their symptoms aren't serious. What would you
Yeah.
say to someone who's been putting off getting their heart checked?
Yeah, yeah. So again, this is kind of where my upbringing comes into play a little bit because I actually grew up so for the first 10 years of my life, I was in India, and then we moved to Atlanta, where I grew up. But the first 10 years, I remember we lived in a big city, but then my grandfather was a farmer, and we would go visit him, and he had rice paddy fields, like huge fields. And it is a different mentality, and believe it or not, it's the same on the other side of the world. Okay, you're in the countryside, and it's the same thing. They are tough. Farmers are
Yep.
just tough people. Okay, and it holds true on the other side of the world. And I bring that back, and I'm like, okay, look, I understand, because I've had this conversation with my granddad. I'm like, hey, look, there's something going on, we got to do something about it. And he's like, nah, no, no, what are you talking about? I just need to get out there, get out in the sun, drink some water, eat some food, and sleep, and I'll be fine. Look, I understand that, and I get that, and I respect that. I really do. People are tough out there, but at the end of the day, I think if we can help, right, and we can make a change in someone's life, whether that is you're able to do more things without being short of breath, or you're able to live longer. I think it's meaningful. I think you should seek care, right? And there is a lot of distrust, right? Like, I just want to touch on that a little bit, because
Yeah.
when you're living away in a countryside, there is a lot of distrust as to what is the agenda, right? Why are physicians coming from elsewhere to here? What is the agenda? And trust me, I've heard that on the other side of the world because it's the same thing. They're like, what are you guys doing here? Like,
Yeah.
what are you here for? You know what I mean? I want to say it's good to have a little bit of that, right? To question what it is, the intention is. I think that's always good. But at the same time, you have to understand that, personally, when I was given this opportunity, I was like ecstatic because I was like, oh, could be a little bit of outreach that I miss in my life. Where in training, I went to Nicaragua, I went to all these places where I couldn't talk to people that had the same healthcare that people have easy access in Denver, right? So I think what I'll say to people who are holding off, which was your main question, is to say, just have a conversation. Conversation really never hurt anybody,
Yeah.
in my opinion, right? Just come talk to either me or Sam. Maybe it's nothing. Maybe you're right. Maybe it isn't anything that we can help with, but at least now you know. And maybe it is something that we can find and can help, right? And it may be, like I said, one day in the hospital, you go home the next day. If it's going to help you live longer, I think that's worthwhile.
Yeah.
So I would say if you're holding out, just have a conversation.
And so going back to something you said, why are you, what made you choose us or to come out and
Yeah,
do this outreach with
sure,
our community?
sure. So partly it was the fact that there was a void, right? Sam Rugas, he's a great physician. He's a general cardiologist, and but there was a interventional cardiologist that used to come there, but stopped coming there because he retired.
Hmm.
So there was a void, right? So it was for me, it was a perfect fit because I was seeking that, satisfaction of seeing patients that are, appreciate you when you come down there, and you don't get a lot of that in Denver, right? Like, because there's abundance of care, right? Like you can just go to another guy down the road, right?
Uh-huh.
So, but to me, there was something to. I love people who appreciate you when you do something for them, right? And I think people in rural areas like Burlington have that approach. They are very thankful and they're very nice and they're very, glad that you're there to help them. And to me, that connection is super important. So that's one of the reasons I said yes. And I was able to, again, back to the point of making an impact. I was there the last 2 months and I was able to help patients that actually have the valve disease we're talking about, where I recently saw a patient in Denver and took care of them. So, and that's kind of why I chose to come down, and so far it's been great.
Yeah. So is your specialty of the heart different than Dr. Rugas?
So I'm an interventionalist and structural cardiologist. So he's a general cardiologist. He's able to do, take care of ultrasounds of the heart. He does what's called TEEs, where he puts a probe in the mouth and checks the heart, things like that. He can do stress tests and all those things. The piece that I'm able to do is fix the valves and the arteries that are blocked. That's the piece where me and him are different.
Gotcha.
I,
But
I do those
you work together.
procedures.
Hmm.
Correct, correct. So
Awesome.
if he finds a patient and says, "Hey, Akhil, this patient has a blockage. I want you to put a stent in," then they come talk to me and I do the procedure.
Awesome. I do think it's very neat too because I know somebody recently that went to Denver for a stent from here, and that patient was very happy to see a familiar face there because she'd
Sure,
received care here and then said, I saw my doctors up there too. So I think that's
sure.
really neat.
Absolutely, it matters. Trust is huge in
Hmm.
healthcare, right? I tell patients that all the time. I'm like, if you can't trust me and what I'm saying, then maybe I'm not the right guy for you, right? It's your body at the end of the day. You're putting your life in our hands, and I take that very seriously. So, if human level, right, then it's not, it's maybe I'm not the guy for you, right? But on the other side of things, when you have that trust, it's amazing, right? I
Yeah.
mean, like you said, I see them there, and then we schedule a procedure and I say hello to them in the hospital, and they're delighted, right?
Yep.
And they're quite happy. And again, recently, back to the guy that I recently saw, he was so happy to see me. He's like, "Hey, Reddy, how you doing?" So it's good. It's too good to have that connection and that continuity.
For sure. So, and I know we already kind of touched on diet and exercise, but what are some things people can do to reduce risk in the future? And is it too late for somebody to change their ways?
Yeah, I mean, the answer is no, it's not too late. Okay. It's never too late, in my opinion. Reason I say that is because, there's data out there, even when people like change habits acutely, like within a week or a month, even people, you start seeing changes in your blood sugar levels, in your inflammation, and all that. So I don't think it's ever too late. So if you're thinking about quitting smoking, if you're thinking about maybe I should eat less processed foods, maybe I should walk more, the answer is it's never too late, in my opinion. It's always going to help, right? It brings the blood pressure down, it brings the diabetes better controlled. A lot of things play a role when even losing 5 pounds of weight, which is tough, but when you do it, it's tremendous for your body, right? And yeah, I don't think it's ever too late.
So are there any like fruits or vegetables or proteins that the heart particularly loves?
Yeah, I'm not so sure I would put it that way. I think, I mean, that's a good question. I think the way I would answer that is the heart likes to be efficient and to be calm. So the blood pressure control is huge, right? So it comes down to that. Like, are you reducing your blood pressure so the heart can be more efficient? And that's the problem, right? People, that's why hypertension is bad. High blood pressure is bad, right? And diabetes is bad because of inflammation in the arteries. So the way I would answer that is I would say, whatever reduces your blood pressure, brings your sugar down, that's what you should be doing. And
Okay.
we kind of know what that is, right? Like, keep the salt low, right? Keep the sugar low. And it's very hard to do. Believe it or not, you read these packages of foods we buy, and they add a lot of salt. They add sugar. Stay away from those. The ultra processed meats, foods. I mean, July 4th, sure, you want a hot dog? Fine. It's okay, right? Like my kid had one, and I was like, okay, all right, you know what? Or you're at the Rockies game. Okay, fine, all right, right. But there's
Yeah.
got to be some sort of balance we have to find in life. Like if you're eating every single morning, you're waking up and eating processed meat like sausage or bacon. I mean, it's tough to come back from that, right? So that's where I would make those changes. So fruits and vegetables, like you said, I wouldn't say any specific fruit or vegetables. I would just say eat vegetables, right? As much as you can, right? I mean, I'm not saying just stop eating meat. That's not what I'm saying. I'm talking about just being mindful of portions.
Yeah, and how your body responds to those different things that you eat.
Yeah, absolutely.
Yes. So, looking ahead, what developments in cardiology are you most excited about, and how do you see the heart care continuing to evolve?
Yeah, I think preventive healthcare is huge, right? Prevention is where, I mean, sure, we have all these devices and, procedures we do that I just went through, right? And that's available. That's great. Okay, but prevention is huge, right? You rather not have the problem. Sure,
Yeah.
we can fix it, but I rather you don't get the problem. So I think that's where cardiovascular health is going, is that they're developing drugs. I mean, I'm sure you've heard of all the weight loss drugs they have, and we have now better medications for cholesterol than just statins, right? We have these injectables, and now there's coming in pill forms too, and GLP-1s for diabetes. There's so many medications that are preventing things from escalating, right? So I think that's where we're going. I mean, I truly believe avoiding medications is important, and trying to be healthy to begin with is important. But at some point, if you need assistance with cholesterol control or diabetes control, there's major breakthroughs happening where I think taking those drugs are leading to meaningful changes in people's life, where they are living longer and they're living better. I think that's where cardiovascular care is going, is prevention. And that's huge. And I don't know anybody that wouldn't want to prevent disease.
Right.
Yeah.
Yes. But there's always going to be people born with structural defects that are going to need your care.
That you can't help, right? Like, I tell people this all the time is that, whether you believe in a higher power, God or not, we're all dealt what we're dealt, right? We're dealt a certain cards and we have to play those cards. Your genetic profile is different from my genetic profile. We're all different in that sense that we all have a risk of where we start, right? On a ladder. I just think about it. Some people just start, unfortunately, higher than other people. Some people more prone to getting heart disease, getting diabetes, but that's okay. We can still control that and bring you back to the low risk to level the playing field. That's still possible. But yeah, congenital defects kids are born with, that's, it is unfortunate, but yeah, something we can't help, right? But,
yes.
Yeah.
So as we wrap this up, when it comes to heart health, what is one final message that you would like your now patients or maybe future patients to know about cardiac care?
Sure. Just move, be active. If there's one thing you can take away from today is, even if it means 5 minutes in a day of running up and down stairs, or I don't know, if you are, crutches, maybe getting in a pool if you have access to it, like something you can do, or you even doing like a bicycle. Like I have patients of mine that do, like, I forget the name for it, where you use your arms to the recumbent bike. Sorry, yeah, that's the recumbent bike. Something, right? Something. If you can just move and get your heart rate up, that I will take, right? If you can do that one thing for me. And then just eating good food, right? Try your best to avoid all those packaged foods, if you can take that away today. And then just seek care, right? Even if it is something that you don't think is the problem, let me be that guy to say that, right? Have a conversation with a local cardiologist, right?
Yep.
So, yeah.
Yes. Well, thank you so much for taking the time to talk to
Sure.
us. And we're so glad that you've joined our specialty clinic. And I know that that's one of our biggest days is the cardiac day. So there's obviously a need out here. So thank you for choosing to
Absolutely.
take care of
Absolutely.
our
I
community.
will be there next week. So I'm looking forward to it. Yeah. Thanks for
Okay.
having me.
Yes. Well, thank you everybody for listening to the KCCMH Connection. And if you would like to schedule a conversation with Dr. Reddy, you can check out our website and get the phone number to our specialty clinic. And take Dr. Reddy's advice and go for a walk today and keep taking care of your heart. So again, thank you for joining us on The Connection, and we'll see you next time.
Thank you.